The Office of the Health Ombudsman has released two damning reports following the deaths of patients in Limpopo and Johannesburg. The investigations reveal that the Ombud caused deep systemic problems in both the public and private healthcare sectors. In the public case at Pietersburg Hospital, the report details substandard care, a lack of clinical supervision and the shocking falsification of medical records by staff. In the private case at the Wits Donald Gordon Medical Centre, the report confirms a medical procedure caused a fatal stroke while uncovering serious lapses in fundamental record keeping. The findings have prompted outrage, with the health minister describing some conduct as criminal. To unpack these critical reports and the path to accountability, we're joined by the Health Ombudsman, Professor Taole Mokoena. Prof, good to speak to you this afternoon. Now, beyond the individual mistakes, your report points to systemic problems. What would you say is the single most broken link in the chain?
Well, there is no single thing. It's a series of problems, particularly in our public hospitals. First of all, the shortage of staff in general, and where in many admin or senior positions, they are acting people. That's number one. Number two is that the nurses that receive casualties or emergencies, they're not adequately trained. And not only are they not adequately trained, they are placed there beyond their scope of practice. In other words, we have enrolled nurses working on their own without supervision from professional nurses. That's the other thing. And then the other is equipment. A lot of our hospitals, including Pietersburg, there's a missing equipment. There's also the equipment that's there is in poor state of repair or maintenance, and then the records is another issue. The hospitals are not keeping good and reliable hospital records, which means that it's difficult to carry on continuity of care from different members of the healthcare teams as they leave and the others join in. There's not sufficient recording to inform the ones that are taking over what had transpired before they came on the patient.
Now, the finding that sorry, Prof. The finding that nurses...
Let's continue.
Okay, now the finding that nurses falsified records to conceal negligence seems to be a profound breach of the fundamental oath of your profession. How widespread do you suspect this practice is, and what does it say about the ethical climate in some of these facilities?
Well, I cannot generalize, but I can only talk to the investigations that we did do, because the falsification was at the Retabile Community Health Center, where our patient started to consult. So when the staff there at the clinic learned and realized that we are there about to investigate, they then falsified the records. Yeah, but we can't say that's a general issue. No.
Okay. Now, you talk about not being able to generalize. So let's talk about the sample size that you came up with, because obviously, if you are giving a report of this nature, then it would suggest that there is a sample size that you work with that allows you to then come up with a trend, if you will.
Well, the issue though of falsification of records is not the same as lack of records. The lack of records is widespread, or in other words, inadequate records are widespread. But the falsification was in the particular case that we're investigating, because we were looking for records that scrutinizing the records, upon which we found that there have been tampered with. And of course, and indeed, when the perpetrators were interrogated, they admitted to the falsification. So, but I cannot say that the falsification is general. But what we can say is that there's inadequate recording, because at the Polokwane's provincial hospital, because we were looking at the insufficient supervision of junior staff, both nurses and doctors, then we took random samples, about 6 or so random samples of patient records to determine if this lack of supervision permeated throughout in the hospital. So that much I can say we look beyond the records of the case in question.
Prof, I didn't
perhaps that I'll stop there.
Sorry,
Yeah.
I didn't get an answer to the sample size. How many hospitals and
I
clinics?
said there were 6.
There were 6.
6.
So is
Yes,
6?
but at Polokwane, not at the Retabile. We didn't go through other records at Retabile.
Okay, now let's talk specifics. The Donald Gordon case shows a top private hospital failing on basic procedure and documentation. Does this shatter the perception that paying for care guarantees safety? And what unique regulatory challenges does the private sector present?
Well, I think we have to put this lack of recording into perspective on the part of Vice Donald Gordon. They had a practice that had been going on for a good part of 15 years, whereby they did not. No, they admitted patients at the outpatients at their oncology clinic or ward, but they did not document that encounter, ostensibly because they wanted to save patients expenses, hospital expenses, because if they're not recorded, then they then do not. The hospital would not charge the patient. But that practice is against the law, because the law directs that every patient's encounter must be recorded, and the records must be kept for an extended period. And so that's the issue that we found against that hospital. The actual procedure and the mishap of air embolism that resulted in a stroke, it's a very rare occurrence. Although it is recorded, that happens when the central veins, where the chemotherapy pot was placed, and was being the ambulatory home infusion pump for chemotherapy was being taken out. It happens very, very, very rarely, and it's not for a particular negligence on the part of the staff necessarily.
Okay. Prof, that's where we're going to leave that conversation. Appreciate your time, Professor Taole Mokoena, the Health Ombuds, giving us feedback on a report he recently published.